Number one, I trust that everyone enjoyed their holidays, at least those up to this point in time, and everybody celebrated festively but differently, and that's smaller rather than bigger. So let me just start off by saying, as we approach New Year's Eve, again, let me remind people to cancel. Let me just be just as direct, to cancel all of the New Year's Eve celebrations that require large gatherings, and that's whether you're going out or whether or not you're holding events at your home. Let's not gather in large numbers for the New Year's Eve celebration. So let's celebrate differently, but let's do it safely. So I know everyone will be glad for 2020 to be gone. And I'm certainly ready for 2020 to be a part of our history. But I do want to caution people not to engage in the traditional celebrations for New Year's Eve. Let's not do that. Let me also say to you, please bear in mind that fireworks are not allowed in the city of Houston. And I know Chief Pena can certainly echo that sentiment. So let me just remind people that fireworks are not allowed inside the city of Houston. So, even during these past several days, a lot of fireworks were going off all over the city of Houston, even in close proximity to where the mayor lives. Even a few houses from where the mayor lives. So I don't want to have to leave my house and go outside and tell folk no fireworks allowed. So fireworks are not allowed in the city of Houston. So please bear that in mind. Look, while we celebrate the arrival of the vaccine for key city of Houston employees, we do feel a sense of hope about the pandemic ending next year, but we still have a way to go. And so we must continue to do the same things that we've been talking about for the last 9 months. And that's keep these masks on, the social distancing, washing your hands, all of those protocols that we have been talking about repeatedly. The virus is still prevalent in our community. Today, the Houston Health Department reports 765 new cases, 765. Bringing Houston's total to 116,043. And unfortunately, we are reporting one additional death as a result of COVID-19. That brings our total to 1,544. If I can put it in these terms, even though the numbers are high in terms of the number of people getting the vaccine, the virus, the death number still remains relatively low, and when you compare it to other locales throughout the country. Houston's COVID-19 positivity rate for this week is 11.6%. Last week when we reported that, I think that percentage was 11.2. And again, that's a 14-day moving average. It fluctuates daily as the testing data is received. We report the 14-day moving average for the previous week every Monday. So again, I don't want to necessarily get too caught up on it, only to say that we need that positivity number to start going down. And so it's going to require us working together in order to do that. I would love to report, even in this holiday season, I would love to report next Monday, January the 4th, that positivity rate is going down, even ever so slightly. So please work with us. Let's work together to bring the positivity rate down, to reduce the number of people that are contracting this virus, to move us put us in a much better state. Today is a big day for Houston in the ongoing battle against COVID-19. Houston has received a potentially life-saving gift just in time for the holidays and before the start of the new year. This morning, the Houston Health Department and the Houston Fire Department each received 3,000 doses of the Moderna COVID-19 vaccine. That's 3,000 each. The shipments are part of the Texas Department of State Health Services Week 2 allocation. You just witnessed the first health department staff members received the first dose of the vaccine, and this afternoon, the Houston fire paramedics are also getting vaccinated, and Chief Pena will explain more in a few minutes. They qualify for the vaccine under Phase 1A of the Texas Vaccine Allocation Guiding Principles. They are public health staff directly involved in the administration of COVID testing and vaccinations. And since March, the Houston Health Department staff has operated testing sites and laboratory services serving all Houstonians. I certainly want to thank Director Stephen Williams for his efforts, for his leadership. I want to thank Lucretia Limbrick for her overseeing the distribution of vaccines for the Houston Health Department. I want to thank Dr. Purse, the Chief Medical Officer for the City of Houston. And of course, standing with me is Chief Pena with the Fire Department and Chief Satterwhite with HPD. It's my hope that starting next week that we'll start vaccinating even more people, even beyond the health department itself and EMS workers. So look, we're certainly taking steps to get on the other side of this vaccine. But until we get to that point and more people are vaccinated, simply just want to remind people to be very mindful of your behavior, your gatherings, to keep the mask on, to do everything we need to do in order to blunt the progression of this particular virus. So at this point in time, I tell you what, let me call on Director Williams and then maybe followed by Lucretia Limbrick or Dr. Okay, Dr. Purse.
Thank you, Mayor. I want to start by thanking my staff. With Lucretia Limbrick, the Assistant Director, and her staff who ensured that the day we got the vaccine, we would start vaccinating people who qualified. That certainly saved me a phone call from my boss. As Mayor Turner said, the people we're vaccinating today are actually in the Phase 1A of the Texas Vaccine Allocation Principles. These are people that are directly involved in health care related to COVID. In the Houston Health Department, we have over 260 individuals who are in this Phase 1A. And all of those staff people have been notified, and we're hopeful that they will, in fact, get vaccinated. Over the next few days, we will be offering vaccine to over 365 HISD and Pearland ISD school nurses who currently qualify. All of those are in Phase 1A. We've coordinated with school districts and school nurses who actually qualify or are being notified by their employers. We're also coordinating with home health care agencies, long-term care facilities, EMS providers to serve Phase 1A population that are not yet connected with vaccine providers. Although everyone who wants to get vaccinated will eventually be able to get vaccinated, initial doses are for critical populations as identified by the Texas Department of State Health Services. As vaccine becomes available, availability increases in 2021, we will be able to get you'll be able to get vaccinated in your doctor's offices, at pharmacies, at hospital, and usual sites. The Houston Health Department will play its traditional role. We will serve as a safety net provider, offering vaccines in our multi-service centers based on vaccine allotment and availability. We will also monitor vaccine uptake to identify potential gaps and deploy strategies to ensure vaccine is available to all Houstonians based on vaccine allotment and availability. And what this means is that we will use the same principles and strategies that we use for testing, mobile testing sites, strike teams, to ensure that there is sufficient vaccine uptake in vulnerable communities especially.
Dr. Purse. Okay. Thank you, Mayor. Thank you, Director Williams. Just want to underscore some of the things that have been said. First of all, this is a great day. This is an important day because it is the beginning of the end. Now, again, this is the beginning of the end, so we still got a lot of work to do. We've got a lot of work to do internally and as a community. to make sure that we get vaccine out. We've got our hospital partners have gotten a lot of vaccine. They've been working diligently getting vaccine into those frontline workers. And we've seen the big lift they've had to, and we've been able to experience it here within the Houston Health Department with Decretia Limerick, and Chief Penny's been talking about all the work that Chief White has been doing with EMS and making sure that those folks get vaccinated. And I would like to take this opportunity to encourage everyone who is eligible in phase 1A, tier 1 or tier 2, that if you get contacted, whether it be your employer or a hospital, whether it be the Houston Health Department, whether it be the Houston Fire Department for our firefighters, when your opportunity comes, please feel comfortable, get vaccinated. This is going to help you personally because it will help protect you. And then let's remember, we've been saying this time and time again, that when someone gets infected and they run the risk, obviously, of becoming seriously ill, and that unfortunately we still are seeing that some people are dying from it, but also remember that the person that you are most likely to infect is a member of your very own family. So when your opportunity comes up to get vaccinated, I would jump on that. I would also point out that we've got a lot of things going on globally in terms of the virus, and there have been some changes, and so this is not the time for any of us to rest our laurels. This is a time for us to jump on this opportunity aggressively. And if you can get vaccinated, get vaccinated. I don't meet the current criteria, so I can't get vaccinated today. That would not be proper. But as soon as I can, I will get vaccinated. I assure you that. And I would really recommend that anybody else who has the opportunity to get vaccinated, when you get that phone call, I would respond in the affirmative and get yourself there when they tell you, and just be really happy that you're one of the few who get it early. And eventually, we will get to everyone. It's going to take some time. This is a big nation. This is a big community. There's a lot of folks. We will get to everyone. Everyone will get the opportunity. But let's take advantage of that opportunity when it knocks.
Well, I just want to say that this day has been a long day coming. We consider it Vaccination Day, and I'm extremely excited that we now in the city of Houston can officially say that the Houston Health Department has started vaccinating those phase 1A individuals. Certainly want to echo Dr. Purse's comments and saying that when it's your time to get vaccinated, strongly encourage you to step up and get vaccinated. It's the way that we get to the end of this pandemic. For us in the city of Houston, we have taken the baton, and now it's time for us to run us to the finish line. So again, thank you to all of the staff that make this day happen. We have some months ahead of us, but we're committed to ensuring that we protect the H.
And the Houston Fire Department, EMS, they've received 3,000 doses. That's in addition to the Health Department. So Chief Pinion, give the status of the Fire Department.
Thank you. Thank you, Mayor. Good afternoon, everyone. I want to first start with the good news. I am extremely excited that we received our first batch of 3,000 vaccines from Moderna this morning, earlier today. And we're extremely hopeful that this vaccine is going to make a profound positive impact on the safety of our personnel and this department who's been ravaged by the effects of the coronavirus. We've had thousands of exposure incidents. We had over 400 firefighters test positive since the pandemic began. And just within an hour ago, I was informed that one of our firefighters has reported to the emergency room with respiratory difficulties and has tested positive for coronavirus. So we're excited to have this vaccine. We expect this vaccine to provide the safety that our firefighters and our first responders need in order to serve this community. Since the 20th of this month, we've made the vaccine available through Methodist Hospital, and our first responders, our firefighters have responded to that more positively than we had expected. We expected maybe 20 to 30% to take advantage of the vaccine, and reports from staff is that over 50% of those that have responded have said that they will take the vaccine. And that's a credit to our command staff. Again, I want to echo what Dr. Purse said earlier. Our command staff has been working really, really hard to ensure that we're providing the tools, that we're doing our due diligence to request these vaccines and to become a provider. And I want to thank them personally for the efforts that they've made to ensure the safety of our firefighters, especially one of my assistant chiefs, Chief Matt White in EMS Division. He's been working long hours to ensure that we have the tools available. As I mentioned, the vaccine has been available to our first responders, those in emergency operations, since the 20th. We received 3,000 this morning. We will be prepared to have to administer those vaccines and provide another option for our firefighters. And as soon as we can, we will step into the next phase, phase 1 Bravo, and immunize those that are in the support functions. That way, our hope is to get all our firefighters vaccinated within the month if we could. To date, as I mentioned, currently we have 192 firefighters that are in quarantine for coronavirus. We've had 465 firefighters test positive for coronavirus, and sadly we've had 3 fatalities. And just today we were informed that we have another firefighter in the emergency room. So again, I highly encourage our first responders, our firefighters, that when this opportunity becomes available, that they take advantage of this vaccine. It is our job to serve this community, and this vaccine can only make their job safer for themselves and for the people that we're serving. Thank you, Mayor.
Chief Larry Satterwhite with HPD.
Thank you, Mayor. So this is a great day. About 9 months ago, we stood in front of you, and we were celebrating our first major testing site at Butler Stadium with the mayor and everyone, and to get people tested so that they could be safe, and of course we could try to trap this virus and hopefully stop it in its tracks. We've lost a lot of people since then, so this is a great day because now we stand before you with a vaccine coming to us. So that is a wonderful thing for the city, for the public, for all the nation and the world. So for that, I really am thankful. HPD has always been in support of the health department and the fire department and everyone else for setting up sites for testing, and now we're in support of setting up sites for vaccination, which is something that we couldn't be more proud of to be a part of. And eventually, yes, all of our people will get vaccinated too. We're not in the first phase, but we will be vaccinated, I'm certain, soon, our people. So with that, it's a great day. I do want to take a chance, Mr. Mayor, to talk about New Year's Eve and the celebrations. We want everybody to have a fantastic time and celebrate 2021 because we're all praying for a much better 2021 than what we've had in 2020. But please be safe. Every year we have a real problem with people who have celebrated too much and go out on the road and they're impaired and they're a risk to themselves and they're a risk to the general public. So please celebrate small, celebrate at home, celebrate and don't drink and drive, please. I also want to take this chance to talk about a problem we face every year, which is celebratory gunfire. Please do not go out and celebrate by firing into the air. Whatever goes up will come down, and every year we lose people from that, and people get seriously hurt. So please do not do that. We will be out. We will be out in force. I will be out there. I know Chief Acevedo will be out there. A lot of us will be out there, hopefully trying to protect the public, and all we'll have is great news for the first day of 2021. Thank you.
Thank you. And I think the other essential workers is in 1B. Is 1B? So I anticipate being able to get maybe to the police officers starting next week as well. Having said that, we'll take any one of us can take questions from any of you.
Mayor, or maybe Dr. Burke can talk about this. There's been some anecdotal reporting around the country about so-called extra doses, and so different hospitals or health providers like yourself would get these quote-unquote extra doses. Where do they go? Do you have any thoughts about that? Are you anticipating having excess doses and once you get through all of the city employees?
Yeah. Well, I would rephrase that. I don't think there's any such thing as an extra dose, but there are entities that are going to be receiving in the first wave here more dose than in a week than they can administer in a week. And so there may be some leftover dose from 1 week to the next. But the point is that we need to try and get that vaccine out as close as, so every entity that receives vaccine, whether it be a hospital, a fire department, an EMS agency, a health department, a doctor's office, a clinic, we're expecting that they will adhere to the tiers and try to get through those. But even last week, Dr. Hellerstedt, the state health commissioner, came out and said, when it looks like you're getting to the end of your 1As, then go to the 1Bs. And if it looks like you're running out of the 1Bs, then start, move on from there. And the point is that nobody wants there to be any dose sitting around waiting when so you need to have 3 things. You need to have vaccine, you need to have somebody able to administer it, and you need to have somebody willing. So if you have all 3 of those, the vaccine should be moving. But there may be a time when you got more vaccine than you have people that are, you don't have enough people available to inject them. I suspect there was a little bit of that perhaps in the beginning. But as the hospitals, because they got the largest doses, they've really ramped up. They really have now got, I don't know what the right term to use, but they've got really sophisticated, aggressive systems to get a lot of dose out quickly. And then, of course, you have to have people willing to take it. So right now, we probably have what we're hearing, certainly in the fire departments, we're hearing more people who are interested in taking the dose from the first responder community than we had anticipated. So that's a good thing. So I don't know about extra doses, but at any point you could, all those three things are not going to be at the same level at the same time. So there's going to be a little bit of moving back and forth with that. But yeah, those will move.
And I guess the question for a lot of people, like, so they want the first responders, like firefighters and healthcare workers, to get the first dose. But it's like, who's next, right? There's so many people sort of kind of waiting in line, waiting for their older parents or
Right.
pre-existing
Yeah.
conditions. And they're hearing stories like
Do you want to?
the major hospitals, for example, are giving their stay-at-home staff,
Yep.
or volunteers, they're all getting vaccines scheduled out,
Do you want me to answer? Or
where
do you want
people
to?
may not
Okay.
be able to get their, seniors' relatives scheduled with the general public. So
Yeah.
how do you tell people who are frustrated like that? They're like, well, so you work at your stay-at-home hospital employees, versus my elderly mother.
Yeah. So again, it's going to be a little bit, so we are not, the local health department, we're not in a position to be able to have great vision on what's happening from one provider, vaccine provider, to the next. Those who got vaccine told the state who they intended to give it to, and the state will be watching that. I hear that there's going to be frustration that, because people are going to be hearing stories, and we're hearing them already, of people who didn't seem like they really met the criteria, but they got it from somebody, right? And that adds to the frustration. So I would make the appeal to those that have vaccine and who are giving vaccine, you really need to stick to the priorities that the state has set forward. Having said that, the state also said, well, it looks like you're running out of people in the top tier. Quickly move on to the second tier. And so you can imagine between one vaccine provider to the next, they may go through their tiers. One may go through the first tier much more quickly than another one. So I expect that there will be some of that, but there really shouldn't be a lot of that. Stephen?
And just to clarify, you mentioned older adults. Phase 1B actually includes everybody, all people that are over 65 and older. The second category to that are people that are over 16 and with at least one chronic medical condition that puts them at increased risk for severe illness from the virus that causes COVID-19. And it says such as, but not limited to, and it has cancer, chronic kidney disease, and sickle cell type 2 diabetes. So and in that population, we know that in the state of Texas, there are 8 million people that fall within that 1B category. So there are a lot of people that are actually eligible. I first mentioned that it's important that we try to access those people that are not only eligible, but also willing to take the vaccine too.
And for the older folks or seniors, whether the kids want them to take it or they're in the senior, should they stay in the senior health care facility? Should they contact that place? Should they stay at home? Should they,
A lot of the
who should they call?
A lot of the work that we have been doing, actually it was behind the scenes with Decretia and her staff, we know that of all the nursing homes, the skilled nursing facilities within Houston, that they've actually signed up on the federal contract, which means that Walgreens or CVS will be servicing those facilities. They will send teams out to vaccinate those individuals. There are a couple of hundred of long-term care facilities that did not sign up for the federal program. And so what our folks have been doing is calling each one of those long-term care facilities and trying to link them with the provider that has vaccine to ensure that both the staff and the residents of those long-term care facilities actually have a source of vaccine.
So, and we've seen the list where like HEB and various pharmacies are getting 500 doses, for this round and CVS locally. We should not call HEB to go get a vaccine, right?
Those,
That's already spoken for?
those individuals that actually are in the qualifying categories, 1A or 1B when it's time, can actually access vaccine from those facilities. The strategy behind that was to ensure that a number of small providers who were not connected, particularly in rural communities, had some source for vaccine.
I have a question for Mayor Turner.
Yes.
Before every holiday, you've asked very nicely, tweeted in many cases to folks,
Yes.
keep it small, don't gather, don't travel. So we did that before Thanksgiving, the numbers went up.
Yes.
Before Christmas, the numbers went up. Now we're here before New Year's Eve, and again, you're asking very nicely, don't gather, keep it
Yes.
At what point is it time to do something different? To try to keep the numbers from going up?
Well, it's a sort of situation that primarily our number one is to ask. It's very difficult, for example, to stop people from hosting large parties at their homes. I mean, we're not going to be knocking on people's doors and counting the number of people that they have. People have to be responsible. People have to be responsible. People also have to assume the responsibility that when they hold these large events and people end up getting sick and some people could eventually die, people have to assume the responsibility for that. Those will be needless deaths because they were avoidable deaths. But it's almost like telling people not to go to a club. And they walk into a club and there are hundreds of people in there jam-packed with one another, and then they go back home and they give it to a loved one.
Right, because if the clubs are open, they're going to go.
That is correct.
Many people are wondering, why should we allow clubs at this point, especially New Year's Eve? Every club is advertising a party for New Year's Eve night. Why can't something be done to prevent that?
Well, we are not going to be so paternalistic. We are looking at the numbers, just like I looked at the numbers this morning. The R rate, the reproduction rate in the city of Houston, for example, at our hospitals was 0.83, which is under 1. The number of people that were admitted to our hospitals were less than last week. Okay? So when you keep looking at these different matrix to determine whether or not we are so much worse that draconian action should be utilized, it's very difficult to reach that conclusion. And so we do. We continue to ask people to recognize that when you gather in large numbers, in close proximity, without your mask on, you're creating a very bad environment. But if you're asking me whether or not I'm going to send out 5,300 police officers to be chasing every club and every household, the answer is no. Because what I'm concerned with is about containing people who are out there killing folk. If I had all the resources in the world, I would do it, but I don't. So I have to utilize the resources where we can get the best result. And right now, when I have crime that's increasing and homicide that's increasing, that's going to be my number one priority. And I wish I had enough resources that I can respond to every call that we received about so-and-so holding a house party or a so-and-so club being jam-packed. But when you have limited resources, you do the very best you can. I will say that at some point, people do have to exercise individual responsibility for their behavior. Now, I wish I had a better answer, but I don't. Now, having said that, let me also say that when you look at our numbers in the city of Houston and you compare them to other cities throughout the United States, relatively speaking, our numbers are better, relatively speaking. Even during the summer, the number of people that were in our hospitals were a little bit more than 2,400. Now, today, that number is right at 1,594. Okay? We're better than we were this summer, but the numbers are going up. But relatively speaking, better. If you look at the people who are dying in our city, where people are reporting 3,000 died in any single day. For example, today, the city of Houston is reporting 1. Now, I would like to believe that our healthcare professionals are doing an exceptional job at attending to the health needs of the people within our city. But one death is one too many. So I just wish I had a better response to you. But it's like when we say no celebratory gunfire, and people are firing their guns all over the place and popping fireworks all within the city of Houston. So what's my answer? Do I tell people you have to stay home, stay inside, no fireworks? There does come a point in time when you're dealing with pandemics and when you're dealing with New Year's Eve celebration that people have to assume responsibility. We tell people not to fly, not to take trips. Millions of people are on their planes, flying all over the place. Do we shut down the planes and say the planes you cannot fly? But people are flying. You know?
Speaking of
Well, we're encouraging people to get tested. We're saying to people, if you flew, or if somebody flew to you and stayed in your home, that you do need to get tested. Take a few days, but then you need to go get tested. So if you flew somewhere or somebody flew to you, over the next several days you do need to get tested. So testing is still critically important.
And then just another thing about vaccines, I know you guys said the school nurses are getting them. If there's been a lot of push for teachers to get vaccinated, do you have any timeline on that? And also I was curious about, in the city of Houston, a lot of frontline workers are the public works workers, the trash guys and stuff, they're sharing trucks, they're going out collecting trash, any chance they could get vaccinated?
Well, first of all, within that 1B category, there are a number of people in various occupations that are above 65 and actually have one or more chronic conditions. And so that's going to cover occupations across the board. Within the letter that Dr. Hellestat put out last week, he did allow us to exercise some local flexibility, and we're going to actually meet and look at prioritizing, for example, city employees and other occupations within the community. But we haven't really done that work yet.
I have had conversations with respect. You've got our healthcare workers. We've got people who are taking care of our animals at BARC. I view them as, in a sense, healthcare workers. So that's a group that's high on the list. We have our public works employees that are taking care of our wastewater treatment facilities, which we must keep working. And I think Dr. Percy used the phrase occupational hazard, those where the operations have to continue. So they will be high on the list. Our solid waste workers, for example, will be high on the list. Police officers, for example, are high on the list. And in all of these categories, there are people who are 65 years young. I don't like to call people 65 and over the old. That's not a good description. So 65 years or older, young. With underlying health conditions, there are people in all of these groups that I think would be essential for the city of Houston. Quite frankly, when you look at the number of events that we've had this year, whether they were hurricanes, tropical storms, you name them, those are essential workers. They are needed to keep the city moving forward. So we'll take a look at all of those groups. But for example, the fire department, they got 3,000 doses. As the EMS workers get those and there are additional doses remaining, then they'll move on to the next group, which could be like, for example, police officers and others. What they're telling me is that my date could come up on January the 4th, which is a week from today, is the anticipated date. Any other questions? Okay. Is that the preferred person that you would want to speak in Spanish?
I'll take it for you, Mayor. Thank you, Mayor. Before I give the Spanish one, I want to emphasize something that the Mayor asked me to do, and I failed to do so. In regards to the legal use of fireworks within the city of Houston, it is illegal to set off fireworks within the city of Houston, and it is punishable by a fine. So we're going to have personnel out there, not necessarily guarding for fireworks, but if you're observed setting off fireworks within the city of Houston, whether it's the fire department, the fire marshals, police department, it is punishable by a fine. So again, we encourage people to be safe this New Year's Eve in their celebration. Every year we have injuries as a result of the use of fireworks or property damage. So we want to encourage people to be safe. We have enough going on without adding additional hazards to our lives. So, en español, lo que estamos muy agradecidos que hemos recibido hoy 6,000 vacunas para el coronavirus. El Departamento de Salud recibió 3,000 y el Departamento de Bomberos recibió 3,000 esta mañana. y estamos empezando a vacunar a nuestros empleados. Los empleados que califican ahorita son los de la fase 1A, y en cuanto esos empleados ya tengan la oportunidad de recibir sus vacunas, entonces vamos a proceder para los de la fase 1B. Y esperamos darle la vacuna o ofrecer las vacunas y que tengan la oportunidad de nuestros empleados del Departamento de Bomberos y el Departamento de Salud que tomen sus vacunas durante este mes. Pero vamos a seguir recibiendo vacunas de este día recibimos de Moderna, pero cualquier compañía que tenga vacunas que podamos recibirlas, esas vacunas van a ser usadas para vacunar a miembros de nuestra comunidad. Así es que estamos muy excitados de poder dar estas vacunas hoy y dar adicionales oportunidades para nuestros empleados para que puedan hacer sus trabajos y servir a esta comunidad eficazmente. Mire, para el Departamento de Bomberos esto significa que podemos proteger a nuestros empleados y esencialmente proteger a la comunidad que estamos sirviendo. Hemos tenido más de 450 bomberos que han sido positivos para el coronavirus. Esta vacuna nos va a ayudar para proteger a estos empleados y proteger a la comunidad que servimos, como digo, para no nosotros pasar este virus a nuestros pacientes. El Departamento de Salud está en al mismo nivel. Empezaron hoy a vacunar a sus empleados. Esos son los empleados que directamente están prestando el servicio a esta comunidad. Y así es que es una protección para los empleados y ellos que están sirviendo a las necesidades de esta comunidad. Sí, mire, mandamos una encuesta y de esos que respondieron que iban a tomar las vacunas, más de 50% han dicho que sí esperan tomar esta vacuna y eso está muy bien. Nosotros estábamos esperando un 25, un 30% de personas que iban a tomar la vacuna o tomar la oportunidad, pero hemos recibido adicionales, personas que quieran tomar esta vacuna y eso está bien porque esperamos que todos tomen esta oportunidad. Es una protección para ellos y para la comunidad y así es que esperamos que todos la tomen, pero respeto la decisión de ellos que ahorita a este momento no la quieran tomar, pero sí les pido que si tienen la oportunidad de tomar esta vacuna, que la tomen. Sí.
Well, I was going to add a little bit more to that, but I'm just going to, I thought that answer was quite adequate, so. All right, let's get out their way so they can continue to give these shots. Ms. Limbrick, thank you so very much, for your leadership and all of the staff. Director Williams, thank you. Dr. Purse, thank you also very much. Chief Pena, you're heading back to your shop to give out the 3,000 doses. Chief Satterwhite, they're coming in your direction. Got to wait a little bit longer. All right. Have a good day, okay? Happy New Year, everybody. If we don't have another press conference this week, Happy New Year to everybody. We'll share